Well, we're back here with Dr. Bilski. Very simple question. I hear sealants. What are sealants? I don't know. And I hear they're for kids.
Right.
Like Cheerios.
Yeah. So if you have teeth, you probably should get them sealed, right? Does that make sense? I'll tell you why it makes sense. Sealants are usually done on the back chewing teeth, molars and premolars. So most normal progression of tooth eruption after you are a child and your permanent teeth come in, you'll have 2 molars all the way around. So you have 8 molars, 8 premolars. The research says, not Dr. Bilski, that there's a reduction in cavities by 75%. So what a sealant is, tooth erupts through the gum line, all right? 6 years old for your first molars. As soon as we can, what we call isolate, meaning we can paint this little tooth nail polish on it. It's such a horrible analogy.
No, actually, now I'm getting it.
Yeah, right.
Pinks, blue. What's the big?
They used to have purple, now
Okay.
it's basically tooth color.
All right.
It's a white, it's like a milky white.
Okay.
And some are amber color. It's just so you can see them. That's usually for the pediatric patients. Because we want to know that they're there, still in the mouth after we paint them on. So,
okay.
But it's a non-Novocaine procedure almost all the time. Sometimes we have to numb the gum tissue, but and what it does is it just seals those little nooks and crannies that are on top of your teeth, that when you're chewing, the brush, or after you chew and eat, the brush doesn't fit in those little tiny crevices.
Okay.
So it's not like little Johnny and Susie are horrible brushes because their gums are fine, they're great. It's just that they have such pronounced grooves, like valleys in the teeth.
Yeah.
That it's not their fault.
Well, so is the sealing mostly just for kids then?
No, it's not just for kids anymore. That's the whole thing. Actually, some of the dental insurance programs are allowing for molar sealants on adults. An adult basically is anybody over 12, but we're talking about people our age. So here's the question. I've been very fortunate in my life. I don't have one cavity, one filling. I just don't.
You're my God.
All right. So people say, well, how do you know what it's like? Well, I don't know what it's like to do a filling, but what I do know is how many people we've saved from getting drilled because we painted this tooth nail polish sealant. All right. If we can do that for a child, why wouldn't we do it for an adult?
Sure.
But then the other question is, well, I'm 59 years old. I don't have a cavity. Why would I do it now? Well, that is a great point. All we're recommending is that we do know that they are effective. Why not do that? And okay, I'm healthy now, but if I get the dry mouth and I have medications that are changed, or I get acid reflux, now I have an increase in acidity in my mouth, and then those leak into those grooves on top of my teeth, and then I start getting a cavity. Usually at our ages, the cavity goes rapidly.
Yeah.
It's called rampant decay for a reason. It just hits. And that can happen within 30 to 90 days. So that's why, like you said, twice a year. Randy, I saw you 6 months ago. This tooth was fine. We take intraoral pictures like, look, it's fine. Like, look at it now. So could that have been mitigated with a sealant? For sure.
Okay.
For sure.
makes
Properly placed
sense.
sealants, of course, but it's something I think adults should think about, and I really think it's fair as a patient. If you're watching this, and if you're coming to me, you want to ask me, do I need sealants? And I'm going to tell you, yeah. So you already heard it. But if you're going somewhere else, just ask your hygienist or your doctor to explain to you why they haven't recommended sealants. Not to put them in an awkward position, but that they saw something on YouTube or something.
Well, even if it did put the dentist in an awkward position, look at the position the dentist has put the patient. I mean, come on. I mean, it's okay. Fair's fair. Okay, so
is it awkward or compromised?
I was going to say, ask the question and don't worry about it. Okay, for heaven's sake.
I think in our practice, I can just say that I love what I do, and I take this very serious. But at the end of the day, which is cliche, and I hate that, I really like to have a good time. I like to talk to them like we're talking right now.
We have a good time here.
If say Randy was a patient of mine, and I've been seeing him for 10, 15, in my case, 34 years, we're both about the same. I'm older than him. Like, goodness sake, Randy, why do you always stonewall me on the sealant? So I'll bust his chops. No, I don't do that to everybody. But
No, that's
after a
okay.
while,
That's okay, man. It's,
You get comfortable, and we're just talking. And the last thing I want to do is make this a very clinical, sterile discussion.
Yes.
I'm the doctor. You should do what I do. I know more about teeth because that's what I do. I should know more. And we make recommendations based on research and past experiences. And I think the sealant, in this case, again, I feel another underutilized
okay. Yeah.
service. And I think it's really my own fault, my own practice, and throughout our industry, I just don't think we talk about it enough. And well, today's the day I'm starting.
Well, glad we had the chance to, and thanks for sharing that with us, Dr. Bilski.
Yeah, thanks.